So the dropout rate for students studying medicine in the UK at medical schools can be as high as 14%. How do we know that you will not drop out in the course in first year?
I think I was very resilient because of a lot of past experience. In my GCSEs, after mock exams, I was hardly passing English in either language or literature. And I found out later on that year that I'm probably dyslexic. So I had to work very hard to try and keep up with everyone else in my class. And it was very difficult, and I had to do a lot of things by myself and teach myself from YouTube videos and things like that to achieve the grades that I did, which I got an A in English language and a 6 in English literature, which after my mock seemed almost impossible to me. And I think that I've shown this more recently as well through my knee dislocation. Skiing is my chosen sport, and I dislocated my knee at the top of our local dry ski slope. So it's taken almost a year to get back into skiing and get to... I've had to work on all the muscles and also the fear that it will happen again. So I've really had to overcome quite a lot of difficult and adverse situations. So I feel like that has really helped me to build on my resilience and determination to carry on. But I think that for medicine specifically, I've had quite a lot of motivation through my love for science and anatomy. And my school have come relying on me to teach younger students who are potential students at my first school, through explaining dissections of the heart and lungs at Owen evenings, through language that they might understand, and also reassuring them that it isn't scary and it's okay that these things might seem fearful or they might be scared by these things, but that it's not actually that bad for us to get used to it. And trying to explain that in language that they will understand as year 5s and 6s. From my point of view as a sixth form student, was quite difficult to begin with. So over time I've learned to use simpler language that they will understand. And also I spent some time in a GP surgery working on reception and with the administrators. But I also got the opportunity to experience a minor surgery clinic where the doctor was doing knee injections for people with arthritis. And a lot of the patients were often quite elderly and nervous and sometimes even confused. And the way that he handled reassuring the patient in such a small period of time and also carrying out the procedure was very inspiring to me. And being able to work as part of a team with the nurses and doctors and everyone else, I think will be really inspiring and a really good opportunity for me.
Very good. What coping mechanisms do you have to deal with stress?
I have a very good support network of friends and family who I can always turn to.
Good. The answer was fantastic, and we are doing 8 out of 10. For the rest of the previous students who have gone, look at the pauses, the way she was speaking. It doesn't come out as a rehearsed answer. I don't know whether it is rehearsed or not. But it was pauses. It was looking like a spontaneous question has been asked, and she's answering spontaneously. Other thing, giving you the context. Since the first line of her answer started with the context. That's you're struggling at GCSE level, and then always bear in mind you are not, no one is going to impress at my stage that you have always been successful. I'm looking for candidates who come into cardiac surgery who have failed at some stage and then bounce back. That is the trick. Your true character is reflected there. Somebody who has seen all the success whole lives, the moment they see a failure, they go into depression and all, and very common in the top grade, particularly in top universities, MIT, Harvard, Oxford and all, depression is high. Always in these questions, add a context. What you did very well is that I had a failure, I was struggling, or say in maths I had a phobia, and in maths I was scoring B, I was scoring 6, and then I challenged myself based on the feedback from the teacher, and then I improved. Excellent, very good. Thank you.
Thank you.